Today, I'm answering the question, what is palliative care? Palliative care is constantly getting confused with hospice, and it stops here today. I'm going to explain to you what palliative care is, who it's for, and what it's all about. Generally speaking, palliative care is for anyone who has been diagnosed with a life-limiting illness or any kind of chronic illness that has many symptoms. Simply explained, it is a symptom management program. This program is meant to treat the person as a whole. So I feel like it's a program that is underused in our medical system that I want to try to make people aware of so it can be used more. Are a lot of people on palliative care diagnosed with something terminal? Yes, but you do not have to have a terminal illness to be on palliative care. I'm a palliative care nurse and I am a hospice nurse. Two different programs, two different types of patients, but they are both seen in the home. But there's also inpatient palliative care, meaning you can go to a clinic to see your palliative care doctor, or you can be in the hospital and see your palliative care doctor. The reason why palliative care can be so confusing is because it does vary from hospital to hospital. And it is a little different from Canada to the US. So I think that's why there's confusion. A lot of people throw around palliative care and hospice in the same sentence. They are very different, and palliative care does vary. Depending on which hospital system you're in or which state you're in will depend on what palliative care will give you or provide for you. And that's why it can be confusing. Palliative care is paid for by Medicare, Medicaid, and private insurance. So unlike hospice, which is completely federally funded, palliative care can be funded through your insurance company or Medicare or Medicaid. So who is on palliative care? It can be anyone with a chronic illness, a life-limiting illness, or someone even with technically a terminal illness who is still receiving treatment like chemo or radiation. The point of being on palliative care is to help with those symptoms that you have either from your chronic disease, from your life-limiting disease. These diseases are like COPD, CHF, dementia, Alzheimer's disease, Parkinson's disease, ALS, or the terminal illnesses like pancreatic cancer, where we kind of know that with pancreatic cancer, you will likely die from this disease, but you're still in the process of receiving surgeries, chemotherapy, radiation, and because of all of those things that you're doing, you have a lot of symptoms. So palliative care will help manage those symptoms from either your disease or the treatment of this disease. To me, palliative care is a no-brainer. And I think it's underutilized. People hear palliative care and they assume that means the next step is hospice. That is not necessarily true. And palliative care is truly only here to help you. If your doctor has ever offered you palliative care, in my opinion, you should always say yes. There is literally no downside. If your doctor hasn't offered you palliative care, but you feel like you sound like the patients I'm describing, you can always ask your doctor if that's something their hospital does. In general, I think palliative care should be something that should be introduced to you the second you are diagnosed with some kind of life-limiting or chronic illness. It's only because this team will specifically help with all of the symptoms that you may be experiencing because of this illness that you were just diagnosed with, or because of the treatment that you're getting because of this illness. They're purposely built in to help you prepare for what to expect with the illnesses, how to manage the illnesses, and how to prepare your future because of this illness. Again, there is no downside. It is only here to help you. And most of these programs are built into the hospital system. And palliative care is meant to be in conjunction with your other care. So if you've been diagnosed with some kind of cancer and you are seeing a radiologist, an oncologist, you also can be seeing a palliative care doctor. This is care that's meant to be in conjunction with your other care. Or if you've been diagnosed with new onset congestive heart failure, you can start seeing your cardiologist and possibly a palliative care doctor. So we can work on this as a team, as a whole, to improve your life. So there you have it, palliative care explained. I really hope you have a better understanding of this program. Please pass this video around to your loved ones because this is the #1 question I get. What is palliative care? I hope this video helped. Let me know your questions in the comments And don't forget to subscribe for more death and dying information.